I'm Tiger Robinson. My question is, can the use of psychedelic drugs benefit Americans suffering from mental illness? All right. To start out, raise of hand. Who can guess how many American adults suffer from depression? Lincoln.
30%.
What?
30%.
Okay, I'm looking for more of a number. I'll give you a hint. It's in the millions.
I'm gonna say 10 million.
Okay,
I'm
close.
gonna say 20.
Okay, that's closer. It's a little bit higher than that. Colin.
50 million.
Oh my gosh, you're so close. It is 40 million adults in America suffer from depression. That's so many, okay? All right, next question. Raise of hand. Who can guess how many adults in America suffer from anxiety? Isaac.
40 million.
Correct! Did you see on the slide when I was, okay. There's 40 million adult Americans suffer from daily anxiety. And out of those 40 million adults in America who suffered from depression and the other 40 million who suffer from anxiety, 20% of those Americans suffer from some type of addiction. So, psychedelics in the US. Psychedelics are not very well studied. There's very little clinical understanding of their powers. So across the United States, there are very few states who allow psychedelics to legally be used in the public. In order to use psychedelics in experiments, administrations have to get permission from the government to have any kind of access to psychedelic drugs. But the FDA has labeled psychedelics or psilocybin, which is a type of psychedelic, a breakthrough therapy for depression. Here are some of the issues with psychedelics. There's a serious lack of clinical understanding. Due to the way that the government has regulated psychedelics, we don't really have access to them for studies and experiments. And even the experiments that gain access to psychedelics have a very little amount of participation, of experimental participation rates. There's also the possibility of acute intoxication, which is also called a bad trip. This is when you're hallucinating and you basically have like a nightmare, but it's in real life because you're intoxicated, and it can be really freaky. And then also, there have been cases of people who they're high and they think, oh, I can fly. And they jump out of the window and they die. So that's that's bad. So to start out, here's a study from the Proceedings of the National Academy of Sciences in 2015. Scientists took two groups of people. To one group, they gave an LSD placebo. To another group, they gave LSD. During their intoxication, they scanned their brains. On the top row, these are the scans of those who took a placebo, whereas orange and yellow and pink, that's the parts of their brain that were stimulated and were making connections. Now on the bottom, this is the LSD patients. You can see their brains are far more active across the different parts of their brains, in contrast with the placebo group. Here's another study. In 2016, scientists collected 12 clinically depressed experiment individuals. 9 out of the 12 took the QIDS test, which is a national depression ranking test, and they scored severe. The other 3 of the experiment participants were diagnosed with moderately high depression rates. So, as a total group, the average participant scored 19 out of 25 on the QIDS ranking test. So they were very depressed. So scientists gave each one of these participants 25 milligrams of psilocybin. Then 1 week later, they asked them to take the QIDS test to see if their depression had dropped at all. And as you can see, it dropped about 50% after 1 week, just because they took 25 milligrams of psilocybin. Then after 3 months, their depression started to, it gained a little bit. But there was still a drastic decrease of their depression rates. So this guy, I'll just show you the video and explain it.
So in terms of addictions, we have looked at psilocybin for treatment of tobacco dependence, cigarette smoking addiction, and that's being done with by my colleagues at Hopkins, Matt Johnson, and Albert Garcia Romeo. And what we showed was in an initial pilot study of just 15 volunteers that psilocybin in combination with cognitive behavior therapy produced immediate and long duration abstinence of cigarette smoking. So at 6 months, 80% abstinence rate, biologically verified, which is unheard of in the cigarette smoking area. Cigarette smoking is one of the most difficult to treat addictive disorders there are. And so.
All right, so that guy, what up? Let's see. So that guy, that old man, he's a psychopharmacologist, and he's a professor of neuroscience, psychiatry, and behavioral science, and he's also the director of the Center of Psychedelic Consciousness, for Psychedelic Consciousness Research at Johns Hopkins University. So that guy, he's a goat. He's insane. To rehash what he said, because I know it's easy to zone out while we're watching the video, scientists gave 15 cigarette-addicted patients some psilocybin, and then after 8 months, they found that 60% of those cigarette-addicted participants were completely abstinent from cigarette smoking. This is like it's groundbreaking discoveries. There has been no case of that rate of abstinence after 8 months ever seen before, especially in the area of cigarette addiction. So in my opinion, although the amounts of data provided are short and they're dependent on very small amounts of participants, there is a repetitive trend that shows that psychedelics have the power to heal those suffering from depression and addiction. And there is still the problem, however, of people who have bad trips. Let's talk a little bit about that. So this is Sean Illing's experience. Sean Illing attended an underground ayahuasca ceremony with a bunch of other people. Ayahuasca is a psychedelic. So he was laying on the ground with a face mask on, hallucinating, and all of a sudden he noticed he was having a bad trip. He saw himself as a teenager melting into particles and then disappearing. And he was freaked out, so he sat up, took off his mask, and he looked around at all the other people in his ceremony, and he saw they were like shape-shifting into shadows, it says, and he thought he was dying, and he was really freaking out. And then one of his group guides, Kat, noticed that he was freaking out a little bit, and she started singing to him. And he says he couldn't make out the words, but the cadence was soothing. Quote, "After a minute or two, the dread washed away and I settled back into a peaceful half sleep." End quote. So, similar to what this guy said, So earlier in this interview, we don't have time to show it, but Dr. Griffiths explains that these types of therapeutic benefit are only capable in partaking of psychedelic drugs if there is therapeutic support given. Similar to how in Illing's experience, he had a group guide who was able to keep him from getting, a bad trip, or keep him from jumping out a window in case he thought he could fly. So, a simple solution to the issue of bad trips is, if ever psychedelics are legalized, as long as they are taken under medical care, as long as there is a provided and trained group guide or therapeutic supporter, this will be a lot safer, and it'll prevent any types of risk from bad trips. Not only this, but as the Food and Drug Administration has said, psychedelics are a groundbreaking therapy for depression. And under therapeutic aid, psychedelics will benefit the millions of Americans facing mental illness. Now here's just something extra. I found this out yesterday. There is a state that's legalizing psilocybin on Tuesday. Can anyone raise their hand and tell me? Berkeley.
Oregon?
Yes, sir. Of course it's Oregon. All right, here's my works cited.